Hi, welcome to the next section, tips and tricks, diagnostic IMO procedure module. So first, you have to go to the SOAP template, and you want to make sure you add an assessment to associate that diagnostic study to. So first, click on Assessments in the Assessment Plan panel, and then click on Problem IT Plus to search for your desired assessment. Once you have found the assessment you would like, then click on the plus sign, which is here, and add to today's assessment. So adding your assessment continued. You could also access the assessment tab by clicking on the My Plan hyperlink, which is found right below checkout. And you can add your assessment as well. Adding your diagnostic study. So first go to Diagnostics, then click on Assessment. On the assessment you want to highlight and associate to. So for example, here it would be lower thoracic back pain. Please note also that with the new upgrade, whatever assessment you have highlighted in, for example, the assessment tab or my plan or AP details will continue to be highlighted throughout the rest of the tabs. Then click on the procedure IT blue icon, which is here. And that should open up a module for you to search for a diagnostic study. So let's see what that looks like. So as you can see, it will look like this, IMO procedure IT search. So click on the searchable free text. And then once you fill it in, you will want to click search. And then you will get a list of diagnostic studies. And once you have that list, if you have found the desired one that you want to place, then click on the plus sign. Please note you want to try to be as specific as possible. If you just click X-ray, you will get a list of a bunch of X-rays. There are different X-rays that you might not be looking for, so try to be specific as possible. Then it should look like the image below down here. You will have your ultrasound examination of the kidney transplant as your diagnostic studies, your billing diagnosis of lower thoracic back pain. So once you have those two clicked in, the last step is you want to click on this place order. Please note that if you don't click place order and move on to another tab, then that information is going to be lost and you're going to have to do it one more time. So once you click place order, this tasking window should pop up for residents / medical students. Task your supervising provider attending. For providers, staff providers, or attendings, you don't have to click on the tasking button. You can just click cancel. So adding your diagnostic studies continued. Once you have finished ordering the diagnostic study, the diagnostic study will appear down here in the bottom, and it should say ordered. If it's not there, then it wasn't processed successfully. And you're gonna have to redo the steps. But if it's there and that's the only one you want to place, then click on save and close down here. And then you're gonna want to transition over to checkout and do the second step, which is requisitioning that order. So click on checkout diagnostics on the left-hand side, and then highlight the study you want to do, you want to requisition. If you have multiple studies, you're going to have to do them one by one. You can't highlight them all and click requisition, so one by one. So once you click requisition, the document will populate. If you are a medical student or a resident, please just close that window. If you are an attending or staff provider, then you're going to want to sign off on that. And that is it. If you have any more questions, feel free to contact us at emrtrainers@mednet.ucla.edu or any of our phone extensions, which are provided there. Thank you for joining.